Hello, my name is Deidre Johnson, and I'm the CEO and Executive Director for the Center for African American Health. Welcome to Season 2 of Pearls of Wellness. The purpose of this podcast is really to discuss the social determinants of health for the Black community. And when we talk about social determinants, those are those things that are really so important to keeping us healthy that have nothing to do with being in the doctor's office or in the hospital. Today joining me is my good friend, Rossina Schroeer-Santiago, founder of the Therapist of Color Collaborative. Thank you for joining me today.
Thank you for having me, Deidre. I'm really excited to be here with you discussing a very important topic, very near and dear to my heart. So thank you.
So first, let's start out by sharing a little bit about who you are and why you do what you do.
So yes, you gave me a bit of an introduction as far as being the founder of the Therapist Color Collaborative. But a little bit about me is when I think about why I did this work is I was looking around the landscape shortly after I had gotten out of the military and just seeing that mental health was just becoming a problem. In my work and what I was doing as human resources, again, people were persistently bringing me their problems. HR is kind of a quasi mental health professional. And so I had been consistently exposed to people and their suffering and their different experiences. And I don't know, there was just a pull to do something different. And so formally going into school and getting that education, very quickly also seeing the landscape was not diverse enough. I was very having a very isolated experience. And so fast forward to where I am today, I wanted to create a space and community where clinicians of color could have community. And then our broader community of color could see themselves represented in the mental health space, and that they could finally discover and have a confidence in being able to ask for the help that they so desperately need and deserve. And so that's a little bit of a segue into why and where I'm at today.
How many therapists do you have, and can you describe some of them for us when we talk about a collaborative of color?
Yeah. So right now we're kind of in this like 40-ish space of clinicians, and we're currently in the process of bringing on some new candidate clinicians. And the candidate clinicians are postmasters, so they've completed their master's education, and they are working towards they're working and completing their clinical hours towards licensure. And so about, I would say 60%, no, actually about 70% of us are licensed, and then the other 30 are the postmasters working towards their candidacy. And so in our specialties, so we have all specialties of mental health minus the nurse practitioner and the psychiatrist, but we have licensed professional counselors, licensed addiction counselors, licensed clinical social workers, and licensed marriage family therapists, and licensed psychologists, which is really, really important because our licensed psychologists do our assessments and give us the ability to do some more formal and get some more formal information on how we are looking at working with and diagnosing the folks that we're serving. And so it is really nice to be able to have all of those specialties and that really broad stroke look at how we're working with and supporting the folks that we are taking care of.
Wonderful. So let's take a moment and talk about how you define mental health.
Mental health is, for me, when I think about what mental health is really the thing that we need internally, the mental processes, the mental way that we're thinking about things, our behaviors that really impact how we live, work, and interact in our environment. When you have a problem with your mental health, I think people, which we don't often see it because it doesn't always happen all at once, but when we start experiencing mental health concerns or mental health disruptions, these are the things that we start experiencing in our day-to-day lives that really take us out of sorts, right? You might start feeling like your wind is not helping your sail go the way that it used to. But I really think when we start looking at disorders and disruptions and things, we're looking at the things that are out of sorts, that aren't allowing us to function and think and act and operate in our environments in the way that we normally would. And it starts creating, in many ways, what we call dysfunction, right? We're just not able to live, be, act, work, play in the way that we used to. And so that's a very good indicator that something is happening in your mental health.
And why I think that's so important is so often we look at mental health or people talk about it when someone's in a crisis, they're hospitalized,
Yeah.
and nobody. It's like you're in the fire versus what you could do to prevent it.
Absolutely.
And then when you're talking about our community, when you think about racism, microaggressions,
yes,
that's another layer that no matter how you might think you're riding it through, really does affect your mental health.
Yeah, no, and you are so right. I mean, and that's where it's so important for us to do and promote mental health literacy. And for me, mental health literacy is like, how are we promoting education, empowering people with knowledge, empowering people with resources to be able to understand and just be able to make and form decisions about how they're engaging with things. Because without mental health literacy, we do have these myths and these different aspects that, mental health is only when people are having crisis. We don't often, like when we think about our mental health in terms of, if we put it in that medical model, we don't wait until we're having a heart attack until we go see a doctor. That's really that's the crisis. We want to do that preventative aspect, right? Which is being able to do some work ahead of time so we can avoid and mitigate the possibility of it turning into a crisis. And that's where, I think a lot of our work spans and focuses on, is we really want to mitigate waiting until the crisis. We want to do some prevention and education so we can empower people to be not just for their own mental health, but also being advocates and helping other people see the importance of it.
So when you think about our community, I'm almost starting to lose track of how many suicides we hear about in young people.
Yes.
Suicides among Black women. What are some of the current crises we're facing that people may not know?
Yeah, I mean, when COVID hit, COVID was just kind of like the initial aspect, and then we moved into what some are starting to name a bit of a racial pandemic. Has been some new kind of terminology, because we were thrust into everything that happened from George Floyd and Sandra Bland and Tamir Rice and just all the different things that we experienced there. So we not only had a health pandemic, we are experiencing a bit of a racial pandemic. And on top of that, when we were isolated, right, there are different things that happen with social isolation. So people forgot how to connect with people. But in many ways, I think COVID was one of the greatest things that could have happened in our community, because it really made us sit there because we couldn't get out there and socialize. So it really made people pay attention to those things that were hidden and that they had been avoiding and pushing away. And it made them say, I can't do this anymore. Now we're also concurrently working with how do we help people and empower people to get this access, because now we're challenging the narrative of, getting and seeking health. And you talked about it in the introduction, the social determinants of health, right? We are still experiencing extraordinary rates of disparities, from health disparities to race disparities in care, when it comes specifically to healthcare and mental health care. And I think it's important to even highlight what disparities are, right? The different treatment people are getting, the different diagnosis people are getting, the over medication people are getting as it relates to the conditions that they're going and seeking help and care for.
At the Center of African American Health, we often see people from all walks of life. And, someone may say, I'm stressed out, this is happening, and you'll help them with one area. And then you also realize, they're job insecure, food insecure, housing insecure.
Absolutely.
And if those things can be addressed, that's a part of that overall holistic set of resources to really help them transform how they're feeling and how they're functioning.
Absolutely.
So even though we have these different systems, it's all just one system.
It is. And they're all very connected, right? All of these things from health, education, food, economic mobility. I mean, if we're not looking at these things, and I spend a lot of time thinking about just the social determinants of health because I really believe mental health is a catalyst for social change as it relates to the social determinants of health because it is one of the things that influences people's behaviors. And if we can influence how people are accessing and seeking help, we can really begin to influence some of those determinants of health because we are debunking and promoting maybe even a trust and a confidence or even a desire to go get the help instead of waiting until, going back to those crises, disproportionate heart conditions, diabetes, obesity, heart risks and cardiovascular disorders that are, our community is just continuously experiencing.
So, for folks who may not know, without a therapist of color in your community, which is most communities, what's going to be somebody's typical experience if they want to find a therapist that looks like them?
You bring up a really great point because, in all honesty, the greater portion of the folks that seek mental health care are going to not see a clinician of color. I mean, 80% of our field, and only from an 11-year progression, we've only improved that by 5%. Like at one point it was 85%. We are just now getting to where it's 80% white. So then the other 20% is all other racial, ethnicities represented in the profession. So the greater portion of folks in communities of color who are the ones that experience the higher rates of mental health concerns, they're not going to sit across the room from someone who looks like them. And when we think about the importance of representation, it is extremely important in how we are impacting and influencing help-seeking behaviors. And so when somebody's, coming into this space, I think they can start asking some questions about, their cultural sensitivity, their cultural responsivity, and even their cultural competence. I don't always like that word, but, it is a word that is relevant to working in communities of color.
I was talking to someone one day, and I often get this, why do you need a Center for African American Health? Why do you need this or that? Mm-hmm. And I used to come up with all these stats. These days I just say, as long as racism exists, mm-hmm. the need for us will exist. A young woman once shared with me that once she got over the stigma of actually going for therapy, she had a therapist, only went once. And it was because once she started sharing what she was going through, the therapist started crying. And while I'm sure it was unintended, folks don't realize that sometimes that cultural mismatch can actually cause harm.
Absolutely. And when somebody's coming into a space where they're being harmed, it already takes someone, when they're considering asking for help, one that's already an extraordinary amount of vulnerability to say, I need help. And to go into a place where they're hoping to get the help only to have that mismatch where they are shamed, judgment comes in, they are phenomenalized, even this felt sense of being judged, right? That their experience that they are having is somehow either making them feel terminally unique. It is definitely something that will discourage somebody from coming back. And I think in our work, at the Therapist of Color Collaborative, we really spend time focusing on that relationship, that relationship and that connection when you're bringing somebody in. A greater portion, I think it's 83%, they say, or something like that, of our success in therapy is based upon the relationship that we can have. So if that therapist is sitting there crying, making that person feel bad, or even making that person feel like they have to tend to them, that is no longer a therapeutic experience for the person who came in and asking for the help. And so that's really, really important to make sure we are helping people to advocate for themselves for the spaces that they need. Because, I know I cannot be the people's therapist as much as I want to. But being able to help people learn to be their own and better personal advocate, I think that's another form of mental health literacy, right? And I think that's another component that we can continue to advocate and educate people on. You don't have to just sit there with the person who's being placed in front of you. You can ask them questions.
Mm-hmm. That's wonderful. I love that. Mental health literacy. Mm-hmm. I'm going to keep that term in mind. So along those lines, share some of the success rates with regard to folks completing care as well as first-time therapy seekers, because I know it's wildly better than the status quo.
Yes, yes. Now, I am very proud, and in many ways, it still feels very surreal. When I started this, it really still was, in many ways, just a bit of a crazy idea to say I can create a community where not only clinicians of color could come and be supported, but my community could too. And so when we started, our flagship work was working in victim services. And what we quickly found is that many of the people coming in for our services had, the greater portion of them had more than 10 incidences of victimization. Which when we start talking about, trauma, complex trauma, generational trauma, like that's one aspect. So, these were people who were reporting that they had been a victim of a crime over 10 times. Then we started looking at, okay, like who are we serving? Yes, the greater majority of people that come in services are women. However, we started seeing at our highest, we had served as many as 40% men of color, which is almost unheard of anywhere, to be serving that many men of color and working in therapy. And then when we looked at the average number of sessions that someone completes, well, in many of the other kind of mental health organizations and kind of bigger community health entities, average number is about 4. I think
that they complete
before they disappear or fall off the grid.
Wow.
And I think it speaks to what we were just talking about. It's relationship, it's fit, it's connection, right? People need to come in and feel that they're getting the help that they are asking for and that they deserve. Well, in ours, and just how we do it and how we focus on that match and relationship, our rate is 12 sessions on average that people are completing, which most of them, actually continue on, but just on average, they're completing 12 sessions with us, which is a pretty substantial amount of therapy. You figure that's like 4 months of therapy, just about. So they're coming in and they're sitting down and they're actually getting into the things that are important and matter to them.
That's beautiful, because the unfortunate thing is that person who dropped out after 4, typically the system is not going to say, oh, what could we do better?
Yeah.
The system's going to say, oh, they opted out.
Absolutely.
Like all the blame and the weight of it is on them. So speaking of systems, I really want to talk a little bit about the workforce.
Yeah.
We're underrepresented across the board in the health sector, but I think as much as we see a lot of people doing pipeline programs, getting younger kids exposed to what's possible, all of those pipeline efforts are good, but it'll come to naught if we don't address the systemic barriers that young people or anyone faces trying to become a mental health professional. Can you speak to a little bit of that? And then let's talk about what you're doing to change it.
Yes. As we think about this issue and the workforce and the pipeline and what this means, I think we're going to see a couple of phases of this. On one end, there has been some ruling that happened in 2023 talking about affirmative action. And I think that's one thing that I want to kind of touch on. With affirmative action hitting institutions of higher education, I think we're going to, it's already hard enough for communities of color to have access to education, right? When we look at across the disparities within healthcare, there was this number, I think it was like $451 billion that the U.S. had spent between 2014 and 2018, and it was reported in 2021. And it was a 45% increase than what the U.S. had even budgeted. And this was according to the National Institutes of Health. And so I was looking at further statistics and data. They identified that 33 of 50 states where these racial disparities are happening in communities of color, 33 states of the 50 were identified had individuals in those communities with the racial disparities that had less than a high school education or just barely at a high school education. Mm-hmm. So when we're looking at this affirmative action and how it could potentially impact or even deter someone who's looking at the possibility of going to education, we are not focusing on the right thing when we think about how to bolster and build our workforce. We have to build infrastructure within communities that help build and fortify the education platform of that social determinant of health. Like, education is a determinant of health. If we do not have the ability to get education, we do not have the ability to equally access and equitably access economic mobility in the way that we need to. And so that workforce pipeline, just forcing and rushing and getting them to school, it's not it. Are we supporting and creating healthy communities that can support them when they're in school? Because it really does take a village. Like, I remember in my master's program, I had to have so much of a system of support to watch my children, to give me access to childcare after hours, to give me time to study and do my homework, and so on and so forth. And anybody who even gets to the level of master's, right, the professional, that's an even smaller percentage. I mean, when we're looking at 20%, we can digest it down. 2% make it to the terminal degree, which is the doctoral level. And so we're not doing enough to fortify the structures that get us there. Mentorship, groups, support groups, right? Even just making sure that there are peers supporting them and community supporting these efforts financially. In my profession as a clinician, a clinician upon graduation, and we're talking master's level, once they finish their graduate program, they can expect 10 to 15,000 just outside of that, just to cover the clinical supervision.
Wow.
So if you're not doing anything to mitigate that cost, we are now having clinicians having difficulty securing licensure because it's becoming cost prohibitive for them to be able to pay and afford for their clinical supervision.
So I've completed my education.
Yeah.
I'm raring to go, but I need another $15,000 just to be able to practice.
Absolutely. Because we have 2 to 5 years, postgraduate here in Colorado specifically to work towards a licensure. Each state is roughly about the same, and they roughly give us all about 2 to 3 years of postgraduate hours that we have to get in order to be eligible to take our test, right? So, and then we also have professional national exams that we have to do that are hundreds of dollars. And there's a greater percentage of us that don't pass on our first time. And so all of these things, when you think about it, if we are not doing things to promote equity in that space that reduce and mitigate these costs that are cost prohibitive, while there are efforts trying to grow this pipeline, there are other systems and structures that are narrowing the pipeline, that are making it that much more difficult for, individuals coming from historically underserved communities to break way into a mental health pathway and profession. So, I wish there was just a one word, one answer, but it's such a complicated and such a layered problem. And, this ruling with affirmative action is not going to make it any easier.
What are some of the things that Therapists of Color Collaborative is doing to kind of help with that pipeline piece?
Thank you for asking that. I've been really, really intentional to, one, my structure, I've structured myself a little differently. Like, we're not a nonprofit. We are a community-centered social enterprise. And I chose a social enterprise because social enterprise still kind of plays ball in a for-profit space, but I chose a social enterprise model because it's more interested about social impact. And I wanted to make myself competitive to be able to go after grants and to work with partners like Center for African American Health and other things. But I also wanted a way for clinicians could learn the business of private practice. And so the collaboration, it's this really dynamic hub, and it gives us the ability to not only, support our community with no cost mental health therapy, but we can also do low cost and work with insurances, right? And so kind of a dynamic approach to working with that. So yeah, so as we're thinking about the postmasters and the training program, so part of leveraging some of this funding from the grants that I get, I really am asking my funders and the work that we're getting funded for to also make an investment in professional development, because our professional development, especially when it comes to getting additional training. So like right now I have a cohort of 12 clinicians going through a 6-month integrative gestalt, which is a somatic psychotherapy. That costs money. And so we are leveraging our grants and some of that funding to help mitigate the costs that would be cost prohibitive for a clinician, a $1,800 training or a $2,500 certification or something like that. I'm leveraging funding to be able to make professional development, one, a pillar, because not only do the clinicians deserve the opportunity to have access to this training, but our community deserves us having the best, the latest, and the most innovative approaches, right, delivered to them in the work of therapy. And so that for me is one of the main things, is like it's professional development, but it's also creating its two parts of the community. The clinicians, when we're training, we get an internal community where we're training as cohorts. We don't go into training by ourselves. So I think that builds like I don't know, I think of it like a one mind, right? Mm-hmm. We have the opportunity to bounce ideas off of each other. But also when we think about work, we can get internal consultation from each other and supporting, like, well, I was trying this in therapy with my couple. What are some ways in which you've worked with couples with this? And so community internally and community externally, I think, is really important about how I structured it. And when folks come, I think, building on like our work and just how it continues to grow, it has been, it's been something that people are bringing their family members back with them. When they come into therapy and have this experience, they are bringing others with them. And that's also happening with therapists too. The young therapists that are working their way up through licensure, they're referring their friends or somebody they know. We have married couples, we have siblings, we have, cousins, within the collaborative, which is, I think it all just kind of goes back to the way that we do things. We do things in community as communities of color. And so I really, for me, it's just building on that idea. I don't feel it's extremely novel, but it's also very intentional that I'm doing it that way.
And again, what kind of business did you say you are?
A community-centered social enterprise.
I would add that. I would say you're a culturally reflective community-centered social enterprise.
Absolutely. Yes, because we are 100%, as far as our clinicians, 100% BIPOC. And every clinician that's there, I mean, we have African-American, we have Asian Pacific Islander, we have, queer identifying clinicians of color, and so, and we are even building our Spanish speaking platform. So we have 9 of us now that are bilingual and delivering services in Spanish. And so, that's really important to be able to come into a space where you can either be represented, and if not represented, at least be able to connect with someone on some cultural level and not have to explain that experience of what it was like for you growing up.
Mm-hmm. Let's talk about, different segments of the community. I know you're a veteran. What are some of the things that our vets are facing when it comes to access to services?
Yeah, our local VA here in Colorado, for example, and it's not really different anywhere else, but the greater portion of the providers there's very little to no representative care in the VA. So when we're thinking about veterans and just the concerns, I mean, there's a lot of complex trauma, there's a lot of complex PTSD, different exposures. And when you're looking at something that has been compounded by something as unique as service to our country and the different things that we're exposed as a result of that, it is really important to be able to come into a space where some of that, right? So, I'm thinking of one of our Vietnam veterans. He not only had to navigate the racial traumas of being a veteran in that time during Vietnam, but also navigating his own traumas. So for him to finally find a place where he could get therapy, I mean, that is everything for me. And so I think when we think of that work, there are layers to the crises and just the concerns that they're experiencing. And so that sensitivity, that responsiveness, that competency to be able to work in the vein of supporting all of those issues is so very vital and important.
Let's talk a little bit about maternal mental health. It's sometimes it's easy for people to draw a line to, okay, a veteran was at war, is going to have some needs. Mm-hmm. Very few people really embrace the fact that a woman who is going through the maternal journey might have her own needs either before or after. Yeah. What are you seeing in that group of people?
Yeah, and maternal mental health, I think one thing that we kind of forget about the maternal kind of timeline is there's this like preconception, conception, and then birth. And there are so many different things that are happening in all phases when we look at that. And so when I'm looking at birthers and supporting, that particular population, it's looking at what factors were impacting them before conception even happened. Mm-hmm. What supports do they have as, they're navigating this birth? And how are we promoting that education? Because education and access to resources are super important and vital to them during that time. But perinatal mental health concerns, I mean, we have seen it when it comes to the model of care. I mean, we had Serena Williams, when she had her baby, and it didn't even matter the amount of money that she had and the access to care. Her concerns were still being downplayed, like what her experience was and the things that she were identifying that were wrong with her. She was not being heard. And those are the disparities. We really have to break and rupture those disparities that are happening in care in order to be able to influence some of that. And that's, those are just some of them, right? Mm-hmm. The misdiagnoses and the undiagnoses of the mood disorders that happen to birthers either during the pregnancy or post when baby's here, when they're under-resourced sometimes. And just not even having what they need on a mental health level to be able to function, the lack of sleep. Oh my gosh, it's a myriad of issues, right? And I think we could spend a whole, segment talking about perinatal mental health, but, we have a lot of work to do in supporting not just the birthers, but also the families, because men experience just as much perinatal mental health concerns as women in this, because they're the ones that are right there by the mothers or the birthers as they're having the babies. And so we can't forget about our men.
I also know that you have therapists who work with teens and parents with young children.
Yeah.
What are some of the needs
Yeah.
for our little ones as well as for adolescents in this world that's constantly fraught?
Absolutely. One thing that's, starting to show up is just the importance of family, especially in communities of color. The families in many ways have been uninstalled as one of the primary protective factors that our babies and our youth can have. Something as simple as just like playing with our babies and giving them our time, showing up and reading a book with them when they're, very little, and then moving into like grade school and middle school when they're navigating big feelings and big emotions, like giving them permission to have these things. And so, when we're looking at that spectrum of early childhood to even childhood to adolescent, a lot of working with parents and parental education around their communication. We still have, a spectrum of either older parents that grew up very old school or very young and inexperienced parents that grew up with pretty emotionally like truncated parental styles that didn't give this robust expression of emotion. So we have kind of this emotionless, disengaged, put them in front of the TV and the devices and just not engaging, to the helicopter domineering, you can't do anything, right? And not really giving any of these babies permission to just kind of be and experience like the joy and the marvel and the innocence of childhood. But it's also, kind of compounded with those negative impacts of those social determinants of health. And I don't want to keep circling it back to that, but it really is. Those are some really core structures that influence all of what we're talking about right now. And so when it comes to working with youth and the babies all the way up into the adolescents and even young adults, they need so many supports as far as social connection and kind of reinstalling that communication. They are navigating social anxieties in ways that we haven't. They're also facing and navigating racial traumas and living in a world that has a lot of violence, crime, substances, you name it. So, and social media is disrupting a lot of their development and just ability to discern the world that they're living in, because social media really presents a very distorted perspective of the world that we're living in.
Very true.
And this is what our babies are growing up in and that they're exposed to. And so there are so many researchers out there talking about social media and how we got to mitigate and do some work to put some healthy limits. And also, our work on the front end where we're doing that development when they're developing from, itty bitty all the way up, what is our work there as we're contributing to their growth and development, to help them learn emotional regulation, self-awareness, self-advocacy, and even being able to know how to tap into their protective factors that will help them grow, be resilient, and be equipped on an emotional level to navigate some of the things that the world that we're all experiencing, I think. But as adults, we have more resources at our disposal than they do.
So we've been collaborating it's been 4 years. That went fast.
It did.
And I remember it began during COVID just because the need was just so very clear.
Yes.
And looking back, what's been so interesting is, 2020, George Floyd, there was all this performative, we must do something. And whether or not it was well-intentioned,
right.
What we see is resources came and went. If anything, those resources went to white groups who weren't serving us before and really aren't serving us now.
No.
And you and I have both been on a resource warpath.
Yes.
And it's interesting because, folks have said, well, aren't you just creating a parallel system? And that's not the question. You're just creating a system that works.
Mm-hmm.
And so I wanted you to chat a little bit about, as you think about how you want to grow TOCC, what are some of the challenges?
Yeah. I think one of the biggest challenges, especially, you brought up that the funding and stuff like that, it is so discouraging, especially knowing the work that we do and knowing who we're influencing, that, some of this money and funding is going to people who elevate and promote their work on a platform of diversity, dishonesty. That diversity, dishonesty is them saying, we're in communities, we're doing this work. And to your point, it was like, yeah, we're making all of this accessible in communities of color. And shouldn't they be so lucky that we erected these centers and these places for them to access? And the work wasn't really done to actually make sure the people are coming in and accessing, and that there's actually a continuity of care there. Right. And there was no relationship building in the communities. There was no relationship building in the communities. It was just, we're bringing this in and this is who we're serving. And you all should be so lucky that we're here.
And look, we have a white DEI representative. Check a
Yes.
box.
Yes. And so, that diversity, dishonesty of saying who they're serving and how they're serving, I really, I wish and my hope is that, these funders are really addressing that impact and that they're looking at impact. And these are not just superficial numbers, but let's really dig into the numbers. When we think about just the work to be able to, deliver services to a community when, like, as a clinician of color, I'm concurrently experiencing the world that my community is experiencing.
Mm-hmm.
And I think that's also the beauty of, why TOCC is the way it is, we have each other to check in on each other. But, when a clinician is out there in one of those other spaces, they don't have anybody supporting them, right? They're often isolated and experiencing that all by themselves.
So one of the things we like to do in these discussions is always end on solutions.
Mm-hmm.
You've created a solution. For those who might be watching or listening to us at home who are thinking about, how can I take better care of me and mine in this world?
Mm-hmm.
Do you have any suggestions for them?
Yeah, I think the biggest suggestion is, it goes back for me, mental health literacy. The more we can spend time learning and understanding something that has for so long had so many myths and so many stigma, the more we are talking about mental health way more than we ever have in the course of history, but there's something that really sticks out for me. Like, there was this 1999 Surgeon General quote that was talking about racial disparities and all of that. And statistically, we aren't, like, 24 years later, we still haven't moved the needle as much as we need to. And so I think the work is being able to, like, leverage that mental health literacy, continue to be advocates. And I really think, advocacy looks like social justice, right? There's that quote, if we don't have justice everywhere and we're experiencing injustices, right? Like, there's no justice anywhere. And so when we're looking at disparities, if we have a disparity in one community, we have disparities everywhere. So we have to do our part to mitigate that. When we can have and create healthy communities and healthy people that are there, we can start building those healthy infrastructures and have things that are sustainable. And so, that literacy, the advocacy, social justice, social change, and more importantly, like, those like you and I that are in this position, like, I think in many ways we are leveraging our social responsibility, right? Because our ancestors forged a pathway for us to be able to do this, and it's our responsibility to continue to lift and do this. And so continue to champion in spaces where we can champion, because it's not a one and done and just one person can't do it. And we have to leverage our allies, right? I think in my profession, where the greater percentage is a white clinician and only 20% look like me, I have to leverage our allies and resources and find other people and magnify and amplify these voices of this work. It's there. It's pockets,
Mm-hmm.
and we have to build ground pools of this. But I do think it really starts with the literacy, changing the way we're talking about things and changing the way we're advocating, and promoting access to these things.
Well, thank you, Rossina. First of all, thank you for joining me today.
Thank you for having me.
Thank you for the work you do, the partner you are, and what you've created. Like, so many lives that you haven't even touched are being changed and will be changed because you were brave enough to see a need and fill it.
Yeah. I think it's great work to be able to be in a space where you can serve your community so boldly and so deeply, and to be able to immediately feel its impact. And so it's hard work, and I love what I do as a clinician, and I love the people I get to surround myself by. And so partners like you, and others that we have in the community, like, none of it could be possible without it. It really does take a village, a community, and that's truly how we will heal. We will heal in community. So thank you.
Thank you for joining us today. I really hope you found some pearls of wisdom that will work for you moving forward, that you can use for your own healing or that of your family or community. One of my favorite poets is Audre Lorde, and one of her quotes is, "Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare." I challenge you to determine what radical acts of self-care you want to take to care for yourself, your family, and your community. Thank you again for joining the Pearls of Wellness. My name is Deidre Johnson. Thank you to our sponsor, Colorado Housing and Finance Authority.